Welcome to Maryland Health Today. I'm Ellen Beth Levitt. When you hear the word cancer, you may think of a tumor growing somewhere in the body. But in leukemia and lymphoma, the cancerous cells travel throughout the body in the blood, bone marrow, or lymphatic system. And there are some new treatment options for these types of cancer. We'll hear about them on the show today. My guest is Dr. Maria Baer. She's head of the Hematologic Malignancies Program at the University of Maryland Marlene and Stewart Greenebaum Cancer Center. And Dr. Baer is also a professor of medicine at the University of Maryland School of Medicine. Welcome to the show.
I'm very happy to be here today. Thank you.
First of all, could you tell us what makes these types of cancers, leukemia and lymphoma and myeloma, what makes them different from solid tumors?
Sure. They arise in the bone marrow, which is throughout the body, or in the lymphatic system, which is also throughout the body. So they tend to involve multiple areas of the body, unlike solid tumors, at least at presentation. They're also very treatable and often curable. And because the cells are so accessible, because they're often in the blood, they're readily able to be studied. And a lot of what we've learned about cancer, we've learned from studying, in particular, leukemia.
How common are these blood cancers?
They're relatively rare compared to those that are cancers that are very common, such as breast cancer, colon cancer. There are approximately 750,000 individuals in the United States with these disorders at this time, which is less common than some of the solid tumors, but they're very important cancers.
Oh, sure. Well, let's first talk about leukemia.
Sure.
How would you describe what leukemia is to your patients?
So, as I'm sure we'll talk about, there are multiple forms of leukemia, but all of the forms of leukemia are cancers that arise in the bone marrow. And the bone marrow is the spongy substance inside the bones where the blood cells are produced. And it has young cells or progenitor cells that produce all the blood cells, and they suffer damage and damage isn't repaired, they become cancerous, and it produces a leukemia of one sort or another.
What causes leukemia?
We wish we understood that better. We have an increasing understanding that there are certain chromosome changes, molecular changes that are associated with or directly cause leukemia. Often, for a given individual with leukemia, we don't know why that person developed leukemia. There are a few risk factors, but our knowledge of why certain people and not others develop leukemia is incomplete, though we understand leukemia better and better.
You mentioned the bone marrow and the fact that the blood cells arise from the bone marrow. Mm-hmm. What particular types of blood cells are affected by leukemia, or does the leukemia spring out of? Which types of blood cells? So
the leukemias arise in progenitor cells that form all of the blood cells. And the bone marrow then becomes abnormal, and you have impaired production of the normal blood cells. And normal blood cells are of three main types: red cells, white cells, and platelets. And certainly in an acute leukemia, all of those become decreased in number, and that's what produces the symptoms of leukemia. So the red cells carry oxygen, and when there's a decreased number of red cells, that's anemia, and people have symptoms of anemia. The white cells fight infection, so when those are impaired, people have infections, fever. The platelets clot the blood, so when those are decreased in number, you have increased bleeding, bruising, and that's how acute leukemia presents, typically with one or more of symptoms of those low blood counts.
And what actually happens in the blood when somebody has leukemia? Are they abnormal cells that start to proliferate and crowd out the normal cells? Is that what happens? I know that I'm describing it in a very sort of simplistic way.
No, but also it's different in the different types of leukemia. In acute leukemia, what happens is that the cells are abnormal. They suffer genetic damage to the DNA, and due to that damage, they don't mature. So you have this accumulation of immature cells in the bone marrow, and the immature cells suppress the mature cells.